It's £6.4 billion that isn't easy to get into the NHS and find NHS money. 3 to 4% of NHS budgets are spent on kidney disease. There's a piece of you that's born with it. You need support. I think the resilience is, comes up as the top traits of entrepreneurs, and I think that's very true in me. I'm a very resilient person. You set your own rules, and I think that if you have passion for a problem, you don't have to be expert. Everyone's talking about AI. Sit down and think about why you need AI right now. Like, really think what your patients need. So we raised £615,000 via Crowdcube that we, have evidence to show that we will save you £580 per person that goes through our programme. It's a very strong position to be in. When you go into health tech, who's really reticent of the NHS being a customer, and there's people like us and many people I know in our networks that are working on health tech innovation are all like, someone's got to do it and we're going to do it. It's what even drives us more. We're providing a digital solution which takes renal rehab from delivering it in one location and takes it across the whole country. The NHS tried to do that and we've got the numbers on what it would cost them to implement a renal rehabilitation service in every clinic in the UK. It's just not a number that they've got. So we were last year on Digital Health London and are really, really grateful to be on the NHS Innovation Accelerator now, which has a 3-year programme.
And that's the national programme.
That's the national programme, which is a game changer. We can laugh and cry together.
And do you feel like there is still hope for the future? Hello everyone, and welcome to this premiere episode of the Inside Health Innovation podcast. This exciting new podcast is brought to you by Acumentis, and it is supported by the Healthcare Innovation Network in London, as well as the Digital Health London team. I am Karina Malhotra, the Managing Director and founder of Acumentis, and your host. In this podcast, we'll take a look behind the scenes and get inside the space of healthcare innovation by interviewing one trailblazing entrepreneur at a time. So, without further ado, let's get started. Did you know that there are 7.2 million people in the UK that suffer from chronic kidney disease? Almost half of them are in the later stages of this disease, where the symptoms become increasingly hard and difficult to manage. Understandably, therefore, the cost of managing these patients and their conditions is very significant for our NHS. In today's episode, I am interviewing Katie Bell, co-founder and CEO of KidneyBeam, who have come up with a solution that can support the NHS in saving almost £580 per person. That could potentially be a saving of up to £2 billion for the NHS. How did she and her co-founder bring KidneyBeam to life? And indeed, what are her visions for the future of KidneyBeam as well as the healthcare system in the UK? Let's dive right in and discover the story behind KidneyBeam and the impact that it's making today. Hi, Katie. Welcome to Inside Health Innovation Podcast.
Hi there. How are you doing?
Nice to have you today.
Thanks for having me.
Thank you for joining us on our very first podcast. As you know, Katie, we're here to talk about health innovation. But one of the things that I find really interesting and often an enigma is, what does innovation actually mean to people? And I've been working in the NHS and in the innovation field for some time now, and I still struggle to answer that question. So let me start by asking you, what does innovation mean to you?
That's a great first question. I think quite simply, it's the creation of something new that didn't exist in the world before. And for me, innovation means creating new ideas, new products that benefit the world in some way.
That's a great answer. Thank you. So let's start talking about how you actually got to the innovation that you got to. But let's start talking about you and your background as an entrepreneur, because you are a serial entrepreneur.
Yeah.
So I'd quite like to understand what made you quit your sort of reasonably successful tech consultancy role at the age of 25 to start off on your own with no real business idea, from what I understand.
Yeah, I was reflecting on this earlier this week, and it couldn't continue being in the corporate world. It was a daily problem for me. I'm from an entrepreneurial family. My dad's an entrepreneur, my brother's an entrepreneur. So it kind of was normal to see business being created in my family. And so the autonomy of that just was attractive, and yeah, it just felt right. And so I had to do it. It was everyone said so brave, but I think it would have been a terrible move to stay.
And where do you think you got your bravery from? I understand that you talked about, obviously, you were seeing it in your family, in perhaps your dad, and I know you mentioned your brother as well.
Yeah.
Where do you think they or you got this from?
There's a piece of you that's born with it. I think my dad had to create business through adversity. He was one of 5 boys born in Canada. And he had to create something new to find his way in the world. So that little choice for him. And I think just setting us up as children, as being able to take risks, know that you can always get through it. But even if you fail, you stand up and try again.
Yeah.
I think there's those early teachings and visibly seeing it that really helped there.
Yeah. No, absolutely. The more risk there is, the more reward, I guess. Talk to us about how, after your first business, which was all about granny's knitting, correct? Interestingly, how did you go from there all the way to Kidney Beam, which is the innovation we're going to talk about more?
Yeah, the journey has not been an ordinary one. And I think I didn't I trained in computer science, so I have a computer science degree. So technology was always a creative outlet for me. I loved coding. I loved creating things. I still think about it now, like wanting to just go to coding and create some of my kids, a game for my kids or something would be fun. It's a creative outlet for me. And because I didn't train in a particular vocation, it allowed me to, technology is used everywhere. It allowed me to experiment with different businesses, with different ideas and passions that I might have had. So knitting was a passion of mine, and looking back out, it is an anomaly why I started a knitwear business and brand. It was fun. And then after that first business, I was kind of adrift, not knowing what to do. I saw an advert for a company needing a CTO to go through an accelerator program that was based at Google for Entrepreneurs campus in London. And it sounded really interesting. So I joined that company as their CTO and went through an accelerator program, which I took so much from. I didn't even know the word startup with my first business. I was just doing business. Whereas all this sort of newfangled support for entrepreneurs, especially female founders, a lot of support out there, it just taught me so much that it put me in this new realm of excitement for creating something new. So after that accelerator, I left that company. It didn't raise money, unfortunately. Great business, but unfortunately just couldn't fund themselves going forward. So I was left trying to do something for myself again, which is where I started. The inception of Beam came about, and I was working on an ability for myself and a kind of workout buddy of mine who had moved to countries to exercise together remotely via video chat, which everyone does now, but never did like 10 years ago when I was looking into it. And I started building this piece of technology that allowed us to do this exercise. And I was approached by my former co-founder, Pamela Scarborough, who is a therapist for people with cystic fibrosis. And she saw what I was creating and really saw the need for her patient population. And she convinced me to kind of point the product and aim it at people with cystic fibrosis. She would create the content. And it quickly came, obvious that there was nothing that was supporting rehabilitation, online physiotherapy for people with chronic health conditions, and how important that was. We started together to form a company called Beam, which then has sort of evolved over the years to become many things, lots of different health conditions we have piloted and worked in. But at the start of COVID, Dr. Charlene Greenwood, Professor Charlene Greenwood now, she approached us wanting or needing to find a solution for her patients with kidney disease, renal rehabilitation. She's a force of nature as a person. She was going to find some solution. And we came together with her to launch Kidney Beam, which is now 4 years on, the company that we're kind of taking forward. It's shown the most traction. We've got solid research around it. So that's the menace, many highs and lows along the way.
And why Beam? Why do you call it Beam?
It was originally called Paxter, which was making a pact with a friend and sizing together. Nobody could say it really or spell it, so it was too annoying.
I did try to Google it, and I kept spelling it Paxter.
We came together with patients. We put out a survey, for a new name. And as a company, as a small group and team, we came together and did a brainstorm. And it was one of our members that came up with the idea of beam, in that she described it as a beam of light.
Right.
So it has lots of different connotations. One is a beam of light in somebody's life as a support. And the other one is beaming into someone's home with exercise and rehabilitation. So it fit really well.
Oh, brilliant. That's really cool. You talked about, obviously, your co-founder, Dr. Charlene Greenwood. I find it interesting. So as an entrepreneur myself, I've had a couple of co-founding relationships, and I've found them challenging at some parts. How do you make sure that you and Charlene create a really successful co-founding relationship?
I too have had a number of different co-founding relationships, and I've also been a solo founder as well. I'm enjoying doing it with someone else for sure. I think it needs that level of support between two people, share the load. Charlene and I are very similar in many ways. We're both very driven alpha characters, passionate about the business in different ways. So she comes from the clinical side, I come from the product side, putting good product out into the world. For me, it wasn't necessarily people with kidney disease, but it serves my passion as well. But we're also very different in a lot of ways and have different skill sets, which is that ideal scenario of finding somebody that complements you. And somehow I think I found that in Charlene. She's very clinical. She's a hustler. I'm more of the product side and some of just the business basics of the administration of the business, which is really important that she doesn't have to do any of that, or the majority of that. We all get our hands dirty where we need to, but we just stay in our lanes. We know where we thrive, and we support each other where we need to, and come together to make the more critical business decisions and strategy, challenging each other. Respect is definitely a word that has come up, and when we do disagree, there's always sort of mutual respect for each other and our opinions. In this, that has led to a strengthening of relationship, and we're very open. You generally can't sit on anything for any length of time. Charlene and I both won't let things, fester. So yeah, we're kind of open and honest, and I think that's key to a successful relationship with a co-founder.
That's great. So let's talk about entrepreneurship in general. You talked about how autonomy played a really important role as to why you chose to become an entrepreneur. But equally, it's really uncertain. It's fast-paced. Decisions come at you every day. You need to pivot often, and so on and so forth. How do you handle what some might describe as pressure and stress, or a stressful environment? How do you handle that?
I think I thrive in those environments, and I don't necessarily know why. I just guess my upbringing that. I think the resilience is, comes up as the top traits of entrepreneurs, and I think that's very true in me. I'm a very resilient person. My husband calls it my bounce back ability. I kind of always know that I'll be okay, whatever happens. So it allows me to take more risks, I think.
Yeah.
It allows me to fail, make decisions. It's funny, in life, I'm not a great decision maker, but in business, I find it a lot easier. I don't know why. I think that knowledge that whatever happens, I can bounce back is one of the mindsets that I have. Also thinking about this, my brother introduced me to a term or a theory called VUCA. Have you heard of it?
No.
VUCA stands for, it's a theory, it stands for volatility, uncertainty, complexity, and ambiguity. And it's like a leadership thing, but it actually comes up. You'll once you think about it, it comes up in life a lot, right?
True.
And I think one of the things I take from that is it's supposed to be all the elements that a sort of leader needs to navigate to find success. But really what I've found is really useful is just understanding and recognizing when you're in a situation of VUCA, and you are and as an entrepreneur, you're very much nearly always in those kind of scenarios, and in life you'll find yourself in those, but recognizing you're there and that there is no answer. It is complex. See, you can't solve this. You have to go through some of the emotions.
Just to ground you, would you say?
Yeah, to stop and to be mindful about the next steps you take. This is a difficult situation. There's no right answer here necessarily. Let's stop and take a mindful and a calculated decision about what the step forward should be, knowing that it might be the wrong one, but that's the whole point. Take one route and then you sidestep and then backstep and go round. It's that being able to breathe before moving forward and that recognition of where you are, and it's not easy.
That's really good because I often find that when I'm sort of going through a VUCA situation, that's a good thing I've learned today. I do tend to want to do about 5 different things to solve the same problem. And I guess as entrepreneurs, we often are fixers, aren't we? We want to fix everything and we want to fix it now, and at pace. So that's really interesting how you take that mindful approach. So you've talked obviously about this sort of mindset that's really important as an entrepreneur. I'm often asked when I do so I go to universities and I talk about entrepreneurship sometimes. And often young sort of graduates who are about to sort of, look for a career and want to create something of their own, because it is a thing that a lot of people want to do now, ask about my advice as an entrepreneur around, well, I'm not an expert on this thing, but I think I've got a solution to a societal problem or whatever problem they're trying to solve, or a pain point they're trying to solve. But if I'm not an expert, can I still go in it and become a successful entrepreneur? And I guess I'm interested in your thoughts on that, because I guess kidney disease perhaps wasn't your specialism. I appreciate you've got a co-founder in that space, but how did you feel going into trying to solve a problem which perhaps wasn't your specialism or expertise?
I think if you have passion for a problem, so you might have a great idea for solving a problem, but that is never going to be an overnight thing. Yeah. So you have to really want to do it to make sure that you'll get through the endurance that it takes to start something. I think you don't have to be expert in it. I don't think at all. Like I've not been expert in many of the things that I've taken on. If you can find a co-founder in the space, absolutely perfect. If not, advisors, like people like supporting people with passion to solve problems, and people do have some spare time. There are people that potentially are, retired or, wanting to. We found that we've been supported. We've brought people out of retirement to support in health coaching and things, where they've, they found that they want to do something during their retirement, and advisory roles are great. I think you can find, if you're passionate enough, you'll find somebody to join the team to help you support yourself in it. Or I've heard of stories of people training in things, like not trained in a certain space, but go into it to be in the business and see what it's like. Anything like TV, sports, whatever, you go and put in the groundwork to really understand it. Yeah. And then, of course, like the customer, you might think that you can solve the customer's problem, but if you surround yourselves, immerse yourselves in those customers that you're trying to solve the problem for, then you'll soon work out whether you've got a solution that's got legs, and you'll also start learning about the in-depth complexity of somebody's, the industry that you want to get in. You need support.
Alongside being an entrepreneur, you're also mum to 3 kids, as I understand, one as tiny as 2.
Correct.
How do you manage both your work and your life, especially as an entrepreneur? I guess my big question for you is, do you ever switch off?
I didn't, but I do now, because I started when I was 25 doing my own businesses, and so I think I had my first child at 33, so I had a sort of period of time where there was no turning off, but I was enjoying it so much that if you enjoy your work, not turning off is not such a major thing. I think it's taken me a long time to get to this place, but being accepting of taking time off now is one of the things I think is a real positive. There's always still guilt, but I'm getting there, and I think that I've set some strong boundaries around needing to leave at 5 to pick up the kids, not going back to work till 7:30 when they're in bed or when they're taking care of themselves. I don't work every evening. I work when I need to and to get the job done, but I do switch off, and this is the best time for me in my children's life, so I'm not going to sacrifice that.
Yeah, it's really nice to hear. there are plenty of women out there who either want to get into entrepreneurship or might be early in their journey.
Yep.
Would your advice to them be, if they're worried about taking on the responsibility of running a business, what do you think they should be telling themselves in that?
Well, there's a huge amount of autonomy in running your business, right? So you set your own rules, and I think that feeling of needing to be at your desk the whole time just isn't true. If you work smarter, you are organized, you can, I think, can be as productive and happier. And there is so many skills of being a mum and juggling so much that really carry through to, will make you a great entrepreneur and a great business owner. I've got to say my husband is a huge support, and it is brilliant. We share, the role of parenting very equally, if not more on his side. So having that support, and maybe speaking to your partner, if you have one, before you are entering into business, is important to make sure that, you are going to be supportive in the endeavor that you go forward in, and you're not going to be still expected to do all of the housework and all of the chores, as well as hold down a business, which is just hard. It's very, very hard. I just can't imagine when my life is going to go back to any kind of routine, and I have to accept that. The same thing is like VUCA, acceptance of your situation, and that my first child, I'd be frustrated with, if she woke up at the wrong time during a nap, because that time I had for working and all that, it would frustrate me, and it makes you worse at your job, and it makes you worse at being a mum. I need to be adaptable. Life is going to throw many curveballs during one half day. She's just got to adapt to it.
Yeah, no, absolutely. Acceptance is quite a big big word. Easier said, but definitely so important in all situations in life, as you say.
Definitely.
Tell us more about Kidney Beam. What does it do? How does it work?
So Kidney Beam is an exercise and lifestyle management app that's designed specifically for people with kidney disease. So we offer programs of exercise, education and well-being to support people at all stages of kidney disease, and whichever diagnosis you have, whichever point in your patient journey, there is a program of exercise and education and lifestyle support for you. And we also offer live, so we offer the medium live and on demand. So we have quite a community of people joining live classes that are run by the King's College Hospital Renal Rehab team, that are kind of take their, 20 years of expertise in running renal rehabilitation and beam it out into, throughout the UK. So yeah, that's in a nutshell what it is. And yeah, we launched in 2020. We're supported by a lot of the major charities in kidney disease. We are in partnership with King's College Hospital, and yeah, currently taking on the NHS.
One of the key things, though, in the NHS, or indeed in any endeavour, you want to work with your customers, as you talked about earlier as well. But in this scenario, did you co-produce this solution with patients or others who are in that condition?
The technology came from a previous platform that was designed for multiple different health conditions, and there is nuances about what's needed. A lot of it is content, though, so the content being driven towards people with kidney disease was very key, and we had a lot of patient involvement in the creation of content. Yes, when we did decide to go into kidney disease, we involved patients, clinicians in the development of that side of the product. We've done a clinical research study, so a randomized controlled trial, 340-person RCT behind us, and we made patient qualitative research part of that to be able to better the product and improve it. We're working with a completely different patient population in terms of age and demographic to what we designed it for. So cystic fibrosis, generally a lot younger. The lifespan is growing now due to an amazing drug that's come onto the market for people with CF, but at the time it was 40. So a lot younger a market, an age demographic. In kidney disease, a lot older. We're dealing with the technology, accessibility issues and things like that, which it wasn't necessarily designed for. So that a lot of the adaptations that we're working on are around accessibility for people that are a little bit less technology literate.
And what kind of things are you putting in place to handle that? Because that is quite a broad spread problem around, not just kidney disease. The population of the country is aging. West Streeting is talking about all the innovation that needs to happen to improve our services using technology. How does that older generation get access to these innovations and these technology solutions when perhaps their digital literacy might not be to the younger population? So what kind of things will work?
Everyone's growing and the older population is not as terrible at technology as a lot of people kind of sometimes make them out to be, but there is certainly challenges for sure. And we have 18, 90-year-olds signed up, so you are dealing with that kind of age group. Simplification, I think, is one of the biggest learnings of the technology, and I think technology in general. We designed the platform as a kind of like open gym where people could come in and pick and choose. We've learned very much that people want to be handheld through. They want to be told what to do. They don't want to choose, and we have the choice. So that's one of the sort of modifications we're making right now, is bringing it down, simplifying it. Gamification, we've not really implemented a lot of. We've sort of stayed away from that. AI, we don't feel we need to move there yet. Personalization is enough. You can personalize it based on people's inputs at the moment, and I don't think there's enough content to really have a meaningful output yet. Yeah, simplification and health coaching. Health coaching was one of the key learnings. It was part of the research study we did, and hence the service we are going out with now, importantly, includes health coaching. And a lot of the health coaching is technology coaching and just enabling people and supporting people to sign up, because any barrier that somebody of that age comes up, they've got, the tolerance for it is a lot lower. I completely understand that. And I'm really passionate and not frustrating people with technology and making their lives any harder. Everything we're trying to do along the way is to make it easier and easier. I think with good design, you can do that.
And how many people use Kidney Beam at the moment in the UK?
We have about 4,000 people with kidney disease signed up to the platform, and using it, a percentage of those, I think we have about 50% activated. We took an approach, because we're supported a lot by charity money, we took an approach of offering it out to throughout NHS England in a way to collect data and to onboard clinical champions to build our networks before commercially, while we did the research behind it. So it's been available to a lot of patients so far. We still kept it quite limited because of our resources. So we did what we could, and we couldn't offer health coaching as part of that, and that's a key part of the ongoing service. Yeah, so we've got a good number of people signed up and using it, but never enough. 800 million people worldwide, that's what we're looking at.
Yeah. And how do you hope to spread this solution out into the NHS?
Through ICB-based contracts. So we have this dream of there being a situation where it could be nationally commissioned, but clearly not going to be the case. We need to go and sell it through ICBs individually, which we're doing right now. But we have, we have built up that clinical champion network, which is really helping to support the rollout, and will do.
You talked about obviously 800 million people worldwide, and I understand about 3.2 million just in the UK, and that's just those who are sort of the stage 3 to 5 in terms of the kidney disease that they have.
Yeah.
Also projected to be 4 million in the next 10 years.
Yeah.
How much does this cost the NHS?
So Kidney Research UK very helpfully did a very in-depth study, a health economic report, which was published last year. It's £6.4 billion, 3 to 4% of NHS budgets are spent on kidney disease. An incredible and staggering number. I didn't know, before being approached by Charlie, I didn't have any idea about how the prevalence of kidney disease was so high in the UK, and one in
costly.
And costly, exactly.
And so a product like Kidney Beam, if it was given out to these circa 3 million patients who are suffering from kidney disease, what could that possibly save the NHS?
So I think important in our journey, and through Charlene's advice and perseverance, we've done this RCT, which has made a lot of difference to evidencing not only the patient benefit, but also the health economic budget impact for the NHS. We can save £580 per patient that goes through our 12-week programme, and that's tailored depending on different stages and different diagnoses. So £580 per patient, extrapolated out, even if we could attract 10% of the UK kidney disease population, it could save the NHS £188 million.
Wow.
10% is not easy to achieve, but in the regions where we have been operating, we are already on 4-5% of people in those regions having signed up to Kidney Beam.
How do you save that money? Is it less appointments? Do you needing to be attended?
It's got a lovely breakdown of where it's over across a number of different things. So it's reduction in medication usage, reduction in A&E visits, A&E calls, community visits, hospital beds. Hospital bed days are probably the most.
Yeah. Sort of reducing the use of hospital beds helps not just save money, but indeed the wider services as well. Yeah. We work a lot in elective care, and one of the biggest challenges often is there aren't enough beds to house people, indeed, and the same, obviously, from emergency care perspective. So it can support sounds like, but also in the broader patient flow element of a functioning trust.
My mum was taken into hospital 2 days ago and spent the night in a chair.
Oh dear.
And I'm like, she's 85. She's, couldn't find a bed. It's just... It's hitting people's real lives, right? So
my mother's quite poorly, and I've had a couple of those over winter, and it is awful. So solutions like this is what we need, which don't just say one part of it or address one part of the system. They actually have that really helpful impact. So you've just talked about how your focus area is the NHS, but you're also looking to take your product abroad. Can you tell us a little bit more about that journey, which areas you're looking at, and how it's going?
We're careful to stay quite focused on the UK. We've, raised a certain amount of money recently to really focus on the UK. So we are trying to stay as focused as possible, but opportunities do come, and it's difficult not to react to that when the patient need is worldwide, right? So in the US, we have been engaged for a number of years with a major charity over there who is supportive of us rolling out into the US and will help us, but we're strategically, like we did in the UK, needing to do a research study to sort of collect local evidence for the product, probably is required for health insurers, who will be our main target over there. So finding our clinical research partner is been our focus, which we have done now. So it's about grant applications, which sort of alongside the UK focus, doing research studies and pilots in other countries has been quite important to sort of keep a simmering effect there, so that when we are ready, we are, do have the right network in place to start scaling. In Europe, Charlene has a very, big and strong network within kidney disease. So given the patient need is so strong, it has been that clinicians in other countries have come to her and wanting to roll out this into their country. Obviously, the language barriers of Europe are going to be a challenge, but we are, talking with a company in Germany about expanding there potentially as our first entry into Europe.
Very interesting. And how easy or hard have you found doing these kind of research studies abroad?
They are usually led by a passionate partner on that side. So while we support them, they can be quite fairly light touch on our side. So it hasn't been too much of a distraction or too much of a heavy lift so far, and they've been quite light. We aren't embarking on big deep RCTs yet, which we will have to do and will always be in our roadmap of any kind of country rollout.
And would you say that conducting these research and clinical trials is really key for a product like yours or any others who perhaps are addressing a clinical condition?
100%. I think that's probably why it took so long for Beam, which I've been running for sort of 4 years before we launched Kidney Beam. We hadn't done that and placed research and evidence into our roadmap, hadn't put a lot of focus on it. When we launched kidney disease, Charlene drove, the research piece home, like needing to do that was very important. Of course, she was inside the NHS seeing what would be needed. And yes, we did embark, she led a really, substantially sized research trial. And importantly, with the health economic piece, to really, be able to now go to commissioners and say that we, have evidence to show that somebody will save we will save you £580 per person that goes through our program. It's a very strong position to be in. I don't know without that evidence what kind of response we would actually have, whether we could even have the conversation. So I think it would be my primary advice to anyone in health tech, to really put that on your roadmap.
And hindsight, of course, is a wonderful thing. And one of the things you talked about is obviously these research clinical trials and how important they are.
Yeah.
Is there anything else you would do differently in your journey on Kidney Beam till today?
I think the simplification of the actual product. Well, it's difficult when you're a small business. You have to be reactive to what clients are asking, what customers, and where there might be budgets for features and things. And we've taken on certain research and certain product developments that potentially have distracted from the core part of the product. And I'd say that was a mistake. I wouldn't do that again. I think you need to really focus on the simplifying it. And from a product perspective, it's like the dream scenario. Keep it simple. Everyone's talking about AI, but we were going to go in for a grant application for an AI. We had some really strong advice from an advisor saying, sit down and think about why you need AI right now. Like, really? Just sit back and think what your patients need. Go back to the patient.
That's good. First principles.
Mm-hmm.
So the money that you've raised, how have you raised it and what are you going to spend it on?
We have been so grateful to the kidney charities in the UK who have provided year on year additional funding to help support us. And even kidney patient associations have seen this. And it's with innovations like ours that isn't easy to get into the NHS and find NHS money. The importance of having those national charities on board, associated patients themselves supporting us has been, paramount. So it's been amazing. And I'd say that through network, Charlene has built such a strong network in kidney disease, given back. She's been pioneering in that space. So that has really helped with the connections to support her in what she's doing. Yeah. And I'm lucky enough to be alongside them. So we raised £615,000 via Crowdcube. So crowdfunding we went for. We had some of that money already secured. So like with every good crowdfund, you need a bit on the side to get it going. Probably unorthodox approach to crowdfunding. We weren't necessarily doing it for the marketing potential of a crowdfund, not even necessarily for the crowd itself, but for the mechanism of closing the round. So we were at a point where our resources were so low and we weren't sure that even if we could even convince friends and family, charities, anyone to put money in, that we weren't sure that we would have the resources to actually close the round. So that we felt that the cost of crowdfunding was offset enough for us to make sure that we could use their legal team to actually do all the chasing of investors to close the money. So that's one of the main reasons we did it. And it was a challenge, but it did turn out to be beneficial in those respects. It was quite light touch on what we needed to do as a team to close the round, but the actual getting the money over the line was a lot harder than we had imagined. Crowd didn't. Dream scenario, like I'm sure 90% of crowd funds don't go, and the success stories of 10% do or splash everywhere. It's hard either way. Anyway, you do it, it's hard.
And what then eventually led to the raising of the 615,000? How did you or Crowdcube make it happen?
It was a kidney patient association. So it was a strong member of our community who saw that potentially we weren't going to succeed in this and rallied together to put in the last amount that we needed. And what we're going to spend the money on, so sales, like putting together the materials, we've already spent some of it on really creating a business case for the NHS. The sales materials we put together have been fantastic. Support and consultancy to help us do that, which I think has been a game changer. I think we're completely in a different position going into sales conversations now than we would have done without that, which costs money. And product, reacting to the feedback we've had from patients and trying to improve the product to improve engagement.
So your target market is the NHS and the NHS integrated care systems. How have those conversations gone where you've told them about the savings a product like Kidney Beam can make for them, £580 per patient? And also, Is there a particular region within the UK or ICB where the prevalence of this disease is more so than others?
Yeah, there is, and that data is available. I think we've taken it from QOF, the Quality and Outcomes Framework. So we've mapped it out on a graph, the ICB with the largest number of prevalence of kidney disease. And it does inform our sales strategy for sure. We are going quite wide on this and speaking to as many ICBs as we possibly can through a strategic direction, because we can't, it's really a small team. So yeah, it does inform that, the sales strategy, and the conversations so far we're in the thick of it now. They are a mixed bag. I think it's really helped that we've been implementing throughout NHS England for the last 18 months. We have a lot of clinical champions and supporters in the networks to help us get our foot through those in the door. But it's always going to be a challenge. Investing in an innovation like ours, despite the economic outcome being in our favour, there's a feeling that they're just simply not ready to take on in innovation like this. We're not replacing something in the system where you can move one budget into this budget. It's just not quite as easy as that. And unless there are innovation pots of money, which I hope there will be next year, it's going to be very hard for them to find budget. ICBs are all at different levels of maturity, so and different financial positions. So each conversation is quite different. They could be seen as quite different customers, each one of them. They have to be sold to in different ways and convinced in different ways. We're all still hopeful. We're not, being kicked out the door. I do believe that we can secure contracts. We are going to be ready for when they're ready. So, we'll try and speed that up and try and help to get them there as fast as possible, so that we can be implementing and helping to, one, get it into the hands of patients for the benefit, and two, giving the NHS a little bit back into their pockets for future innovations, hopefully, and help.
So if you could say one thing to these decision makers who are assessing all the different types of innovations that are available to them in the market, and looking at Kidney Beam and indeed other innovations to support them, what would that be, and how can these decision makers really understand what innovation is best for them and their regions?
So it's very difficult. We appreciate that. Like we do really appreciate how difficult it is for decision makers in the NHS, and they've got we would hope and advise that decision makers look at where they are currently spending their budgets, really evaluating what economic impact that is having on their budgets, right? So I think there's a tendency to keep on recurring contracts in things that really are not being evaluated well enough. And, comparing that against new innovations coming up in the pipeline, I think there needs to be that evaluation before there will ever be budgets available for that type of thing and that thinking. So that's what we would hope is going to be the shift towards just looking at their whole budget and evaluate a bit more evaluation of what successes have been and what it means for their bottom line.
Kidney disease perhaps doesn't get as much coverage as some of the other major illnesses do. Does that frustrate you? And what can be done to raise awareness about this condition?
It's hugely frustrating. Before I was in kidneys, I didn't realise of the scale of the problem because nobody I knew had ever experienced kidney disease. But 1 in 10 people in the UK have kidney disease. It just doesn't get the coverage that other health conditions like cancer, for instance, do. Some of the national charities, all of the national charities, but, Kidney Research UK, National Kidney Federation and Kidney Care UK all do fantastic work to change and increase the awareness of kidney disease, including lobbying at government level. I think the government level work is going to be making quite a lot of the major difference. There's a lot of passionate people looking to change that. Every condition is
important.
And we want to raise awareness of kidney disease, of course, but we also do have ambition to move into other health conditions and to support multi-morbidity. We're not so worried as a business that it's not getting a huge amount of coverage. We will be moving into other conditions that will hopefully also help raise awareness as well of kidney disease.
You might have read Lord Darcy's recent report about the state of the NHS. And it was quite shocking for many people, perhaps more so for those not from within the NHS. How did it make you feel? What did you think about it? And do you feel like there is still hope for the future?
So I thought it was a really high quality report, like really, I think it was really important. But I don't think it was a surprise to many people, a lot of the revelations of the state of the NHS. Nobody was really surprised, but I actually came out quite hopeful. Like I don't know whether it's my optimistic self, but that statement of, still showing vital signs was just wonderful. I just thought it was well written. There is definitely signs that we can improve it. And there are so many passionate people within the NHS, outside of the NHS, that are Great Britain trying to solve this problem. And I think we will. I'm really, really sure that we can, with innovation specifically, address it. We do see a lot of the problems, that we have, that are raised, and we have done, and there is a future. It's not like whether there's hope for the future. There is a future, and we have to take on the challenges. We don't have the option of not. There is a patient need, and that need needs to be addressed and supported, and innovative solutions need to be supported to help address those needs. So yeah, that's why we're all here. When you go into health tech, is really reticent of the NHS being a customer, and there's people like us and many people I know in our networks that are working on health tech innovation are all like, well, someone's got to do it, and we're going to do it. It's like drives us more.
As we know that the NHS is looking to refresh the NHS long-term plan and publish it in spring 2025, the three key priorities that we keep hearing about are, of course, prevention, care within the community, and investment in technology and innovation. I find that your product, Kidney Beam, sits quite nicely within those triumvirate of priorities. How do you feel Kidney Beam delivers against those for the NHS?
Exactly, those three were what we pulled out as well. Like, we support and tick all these boxes, as do many of our other companies that we know in our network that are all working on health tech innovation. We're providing a digital solution which takes renal rehab from delivering it in one location, and takes it across the whole country with one delivery of, one cast. Whereas if the NHS tried to do that, and we've got the numbers on what it would cost them to implement a renal rehabilitation service in every clinic in the UK, it's just not a number that they've got. It doesn't make sense. So like, the efficiency of being able to do that through digital is completely obvious, and it will be a game changer for them. Care into the community. We have developed, a number of social features on the platform, and we hope to build more and more social features so that people are supporting each other in this. Introduction of health coaching, that kind of lighter touch, less clinical touch, to support people that might go and use clinical services for something that can be handled with a phone call from a health coach. And prevention, we are more focused towards stage 3 to 5. So there is the treatment and support, but we do slow disease progression. We are able to make sure that the programs that we put out are supporting successful delivery of treatments like transplant. There's lots of different facets. Being able to be a content-based company that can react to different stages and different needs within that, I think it's very important. And primary care stages 1 to 2, we are looking to support in the future a little more. It's harder to get to those people right now, so that's why we're sort of more 3 to 5. But yes, we want to support people across all stages of kidney disease, and hopefully, I haven't got the evidence for it yet, but slow their progression towards later stages.
With the NHS arguably needing innovation now more than ever in its current state, as we've been discussing today, but equally battling with tight funding levels, sort of priorities still being decided with the new government coming in and the long-term plan awaiting to be published. How do you feel about being part of this ecosystem and indeed looking to scale a business in this ecosystem?
I feel optimistic, and it like a challenge, but we are still very much open to taking on. We are going to have to be reactive to the changes and what comes out in that 10-year plan, and what budget we do find, what contracts we can get over the line. We need contracts over the line to be able to both innovate and provide the service and to grow and scale. If we do find that if we are not able to tap into budgets, things will need to change. We might need to look going to expand globally earlier than potentially we might have chosen to. But as I said, we're kind of preparing for that in ways that means that we can pick that up. There will be a point where it will start rolling. All signs of the NHS pointing to intention to move towards, more innovative solutions and finding those budgets. So it might take some time, but we'll be ready when they are, and maybe we have to look elsewhere in the meantime, but we won't stop trying.
And just going back to Kidney Beam for a minute, you've talked a lot about keeping the products simple and how important simplification is for your current audience, as it were, in terms of the users of the product. How are you feeling about wearables, and are wearables a part of Kidney Beam's future?
Yeah, that came up during the research trials. Tracking is expected in exercise-based app. Yes, it's in our pipeline. Where it falls in the priority order is always quite interesting. We do see ourselves as being in collecting an important data set that can be used to innovate further and to support other complementary companies that are bringing out products as well. So data from wearables will be quite important. Right now, it's all self-input, and that's okay for now, but absolutely, it's in our pipeline to integrate wearables, both to give that positive reinforcement to people of their progress and to collect important data that we can then validate contracts with, that we are making the differences to people's outcomes in the real world, which of course customers can all want.
So Katie, looking at the next 12 months, what are your top 3 priorities for Kidney Beam?
To make that first commercial sale into the NHS is definitely top priority. To redesign, but repackage the service that we offer into a more simplistic, easy to use, less frustrating experience for people, with the focus on getting people to complete those 12 weeks of exercise and education that shows that they get that benefit. And the third, to survive now. You just got to, we're a small business. It's hard in this climate. We're being as frugal as possibly can while spending money in the right areas that we have. But survival is key, right? If we're not able to survive as a business long enough to match those timescales of when the NHS are ready for us, then all of this will be in vain. And it's we don't think we'll get there. We've always found a way, and we will. But it's all about survival.
Indeed. Well, I really hope those ICSs get ready for you soon. You have been part of a few accelerator programs, the Google Accelerator program with a different business, but also the Digital Health London Accelerator program with Kidney Beam. What do you find has been most useful that these accelerator programs have brought to you as an entrepreneur, but also your business as Kidney Beam?
So we were last year on Digital Health London and are really, really grateful to be on the NHS Innovation Accelerator now, which has a 3-year program.
And that's the national program.
That's the national program, which is a game changer. Really, so many more programs like this need to be. We're really lucky. It is very highly competitive, and because it is, the quality of it is so high. I think one of from a personal perspective, being amongst other entrepreneurs, seeing the same challenges or being slightly ahead is so critical. We can laugh and cry together. The education, the support, the access to people that will answer the questions. The number of questions you have to ask to get an answer in the NHS is huge. And so I say that it has accelerated that for us quite dramatically. We've worked with quite a lot of consultants that have been recommended through those networks that have worked, turns out to be really high quality, important for our business case to the NHS. I think it's largely been network and support and, camaraderie has really come out of those, but I highly recommend.
And in terms of running the business day to day and all the skills one needs to do that, How did you and Charlene get those skills, I suppose? Or does that come naturally to you both?
I'd say that no one really, I wouldn't say I've learned that from any accelerator. I've learned that from doing and failing and doing and failing. Building a team is an interesting one. Like I'm not naturally, I don't think, a team builder. I think Charlene she's been gone through quite a career in the NHS and she's got those skills, and my former co-founder had those skills too. So I don't think you both need to have them, and I think that's kind of her strengths that I lean on and support. Use that support. Day-to-day running of business, I definitely made the mistake, I think, of doing too much of the grunt work and not outsourcing some things that leaving myself to do maybe more high-value work, such as accountancy, but keeping all of that stuff that you should outsource as soon as you can. But just redoing. And that, Granny's Inc. was one of the things that taught me that, because it gives you all of the basic business skills you need. And you kind of take that for granted sometimes, because I do think that somebody starting out new in a business is quite a lot. That's quite a lot. I remember back in the day, I think there was quite a lot of local support for that in business skills in the borough of London that I was in. I think I probably went to some business education there.
And what would you say you enjoy most about running the business, and perhaps not so much?
The HR is not my favourite. I'm not great. I just don't think I'm great at it. And so I think it's better done by somebody, that is good at it. I'm really proud of the team that we have put together. It feels very right. Some of them work for us for years and really have put in a lot of time and seen us through. And somebody that's not the founder, it's quite unique to find those people. Really grateful to those for sticking with us through the hard times, for sure. Some team members have left and come back. We just had a marketing lead come back, which just feels lovely. But I love product. I love technology. I like managing the technology team. We outsource and all of that. When my head's there and data, I love it. And so that side of the business I do really love. But the grunt work has got to be done. Like, got to file those, file your receipts. And all of the boring stuff is real.
So tell us, how big is the team at Kidney Bean?
So we do work with a number of different freelancers. So like the core team is 6 of us now. And then we work with a number of different freelancers that have some long-term freelancers and some kind of new. And then we have a kind of offshore tech team of 5 people. We're kind of a dispersed team. We're fully remote, but we have been able to tap up and tap down like resources through freelancing.
So you've talked about using freelancers and offshore outsourced tech development team as well. How do you go about finding the right talent to meet your needs? And how do you feel about a lot of your resource being outsourced? I imagine somebody starting out might find some of these elements quite intimidating.
From a product perspective, the disconnect of having a team offshore is definitely one that I prefer not to have. But the benefits of it outweigh for us at this stage of business. It's not now one person that does it all. It's, somebody, you have your QA, you have your front-end developer, back-end developer, mobile. So people I've found, and it's harder to find generalists. So it is costly. And I think I found them through a freelancing website, like People Per Hour or something like that. I think you can just trial projects. Like, it's not too risky, not too expensive to just put a trial project out there, a small piece of what you need developed. We've been at ups and downs with them, but we've been switched out because they're a large agency now. So we've had some developers that have been better than others and more efficient, and we've certainly gotten to the end of our tether with them a number of times. But when push comes to shove, we got a new project on, we go straight back to them and they pick it up quickly and they know the product. I've never worked with an in-house tech team, so I don't have the comparison. Maybe it is a false economy, but so far it works for us. And so while we're at that stage, I am keeping it that way. But quite light touch on product developments right now. It's not a huge expense for us. So
good. So Katie, last question from me today.
Yeah.
If you were a brand new innovator, you've had this great idea, tell us, where would you start?
I would begin with probably forming a team around myself. And that doesn't need to be a co-founder and a team of people to do things for you, even just a team of advisors that you can go to weekly, monthly to support you in the journey, I think is hugely important. I've done it without and I've done it with, and it's black and white, the difference in how much it helps to have those people champion you. So I would certainly build a team around myself first, and then check in on the passion and how much I have with the idea, because you need a lot. Yeah, you need a lot. It's hard work, an endurance sport. Yeah,
it is. And on that note, thank you so much, Katie, for joining us today on Inside Health Innovation podcast and taking part in this endurance sport. We wish you all the best with Kidney Beam and look forward to seeing you again soon.
Thank you so much. Thanks, Karina.
Well, that's the end of episode 1. Thanks so much for listening. And if you would like to follow the stories of the people behind healthcare's innovation boom, please don't forget to subscribe to this podcast and ensure you don't miss any of our future episodes. Till then, have a great day, and I look forward to seeing you next time.